Current surge is hitting the U.S. harder than at any point during the pandemic.
According to the CDC, the 7-day average for COVID cases is now at 277,000. That is well above the average that peaked last January.
Now here in Michigan, the numbers are just as alarming. A total of nearly 26,000 new infections were reported for Tuesday and Wednesday. That averages out to nearly 13,000 new cases a day, exceeding Michigan's previous record.
So far, 75 Omicron cases have been reported in our state. Michigan's positivity rate now on the rise, sitting at 20%.
Now, hospitals are bearing the brunt of the surging case counts as the virus continues to spread throughout Michigan.
Many hospitals across Metro Detroit are now concerned about the quality of care that they'll be able to provide. 7 Action News reporter Jen Shantz is live outside Beaumont Hospital in Dearborn this morning with the toll doctors say the surge is having on the health care we all use. Jen?
Keenan, Allie, emergency rooms are normally a pretty busy part of a hospital. It's where you'll see doctors and nurses triaging patients, figuring out who needs to be seen right now and who might be able to wait a little bit. But right now, doctors and nurses tell us that with COVID, short staffing, and now the Omicron surging around our state, they are worried that they're not going to be able to keep up with this patient intake.
You have to realize there may be a wait and there's a reason for it.
And waiting, especially when you're sitting in the emergency room, can be frustrating. Action News viewer Sherry Warner knows it all too well. She posts that her mother waited in the ER for 6 hours and during a 4-day hospital stay, never got her own room. Warner does say she realizes that staff is stretched thin. It's not a new problem, but doctors like John Duche with Beaumont say the balancing act is getting more tricky, helping patients who are infected and also those coming to ERs seeking non-COVID related care.
All of it has taken a toll. And then when the workforce is stretched thinner, it takes other people to work harder with less.
It's not just the Beaumont health system feeling this burden, it's statewide. 4 Michigan hospitals, including Beaumont Dearborn, are getting extra staffing help from the federal government. The state health department erring on the side of caution right now, saying for now it will maintain current quarantine and isolation standards, despite the CDC cutting that time down from 10 to 5 days. Health experts at Henry Ford Hospital are bracing for a tough January. In just the past week, their COVID test positivity rate jumped 15%.
If we cannot control the spread of COVID-19 infections in our communities, and we don't know yet what Omicron is going to bring us, our community's access to safe and high-quality health care is at risk.
At the same time, doctors don't want people to delay care or avoid coming to an ER if they need help.
We do things the way we do for a reason. You may not understand it completely, but just be patient with everyone.
Now, the state will not be releasing updated COVID case numbers tomorrow because of the New Year's holiday. Those latest numbers will then come out Monday instead. And coming up later in our show at 6 o'clock, I'm going to dive a little deeper into the federal staffing help currently in place here at Beaumont Dearborn and the impact it's making. Reporting live this morning in Dearborn, Jen Shantz, 7 Action News.
Thank you, Jen, for that live report.